This is a special edition of Late Night Health. I'm Mark Alyn. We're going to go to Atlanta and we're going to visit with our friend Dr. Ben Stong. He is a premier plastic surgeon. He has clients coming in from all over the world. And we're going to be talking about lips today. Dr. Stong, welcome back to Late Night Health.
Thanks for having me, Mark.
You have created a new procedure for a lip lift, and we're going to talk about that. But let's talk about why lips are important. You were telling me that they're sensual. Why don't you explain more now that we're recording?
Yeah, well, whenever somebody else's perception of beauty, their brain, how they perceive beauty on a base level, when you first see a face, the eyes and the lips are the two sensual features of the face that
Mhm.
the human brain typically gravitates to and assesses for attractiveness. And so a more sensual looking lip is going to lead to somebody considering you more attractive.
And which is why women want new lips, if you will.
Yeah, more voluptuous lips, fuller lips, at least the appearance of more of a lip instead of, a very thin red lip. And there's different ways to achieve it and different reasons to do these procedures for these people or these women. Filler is a great option, but in somebody with an aged lip or just a long lip their whole life, it can start to cover their teeth and their smile, look a little fake even sometimes. And a lip lift can be a much better option for them. And it doesn't have to be done every 6 to 8 months. It can be done once and then pretty much never again, most likely.
A couple of years ago, there was a popular lip treatment, bee sting venom. You remember that? No?
I've seen some of that nonsense out there, but I mean, yeah, I could imagine it swells from the toxin for a little bit, but then it just goes back. Maybe
Yeah,
that's what you're talking
exactly.
about. Sounds a little bit long way around to get to a result that you could do for on a more permanent basis.
As we age, and I would imagine this is for both men and women, do our lips actually unplump? They get thinner?
Well, really what happens as we age is what's the skin of the upper lip, okay? And then you have your red lip. Your red lip is contiguous with the inside of your mouth, and is actually the junction of your skin and your mucosal membranes of your body. But the red lip is what classically people are referring to as a lip, but you also have the skin portion. As we age, just like everything gets droopier and longer, the skin of the lip gets longer and the red lip rolls into the inside of the mouth, and that's why they start to look thinner. In youth, we have a shorter portion of skin in our lip, and consequently, the red lip is more visible. Now, age is just a number. I see 20-something-year-olds doing lip lifts with me. I see 55, 60-year-olds doing lip lifts. It's really when whether or not they are a good candidate, and then whether or not they want a surgical procedure or something non-surgical like filler.
And as you said, filler needs to be done every 8 to 10 months.
About every 6, roughly.
Right. Um, I see a lot of women who apparently have had either filler, a lip lift, and their lips are there. Dr. Ben has not obviously worked on them. Their lips are out of perspective. Does that make sense?
Yeah, I mean, you can't account for taste. I mean, different patients want different things done. I'll guide them, but if they want, you know, suffi- you know, much larger lips, I'll usually graduate them up with filler. Not do too much all in one sitting. But that's a patient preference thing. Of course, if clinicians are just giving people those types of lips without really discussing it with them, then you're starting to get people who are going to be upset with that person. Uh, and some injectors out there that they don't do surgery, and so they don't know any better. They just keep hammering that square peg into the round hole if it doesn't look good.
Is surgical lip enhancement, is that common now? Is that a
Yeah,
procedure?
lip lifts are extraordinarily common. They popularized within the past, let's call it 5 to 10 years. Actually, the trend started out in California, but historically, the workhorse of the lip lift industry is the subnasal lip lift, and it has limitations to it. Always has had limitations to it, and so it accomplishes probably 60% of what you can do with a different type of technique like the one that I've developed. It just it looks fine, it looks okay, but it needs a little more, I think, or needed
You
a little more.
and the technique that you've created, that you've developed, is called the uh, Peri-Alar lift. Did I get that close?
Yeah, Peri-Alar Lip Lift. It's just scientific terminology for peri meaning around, alar being the nostril. And so it goes not just beneath the nose, which is what a subnasal lip lift is. It wraps around the nostril, removing skin further laterally, or out from the nose, and allows for a shortening of the width of the lip, not just the vertical height. Additionally, it gives a more broad-based lift to the red lip portion.
So the,
So it looks more full and more natural all the way across, whereas the subnasal usually only lifts the middle third, middle half of the lip, and doesn't do anything to the outer corners typically.
so this would be the red part, and
Hmm.
this is the
Skin.
other, the skin. So if you want more of that red to show,
Hmm.
uh, the Peri-Alar lip lift is the way to go.
Absolutely. The results are just clearly better than the subnasal lip lift.
Uh, can you show us on your face, pointing to the various parts of your face, where the difference is and how it works? Is
Yes, I don't have I wish I had a pointer instead of my
right.
finger. Um, let's see. So the Peri-Alar lift starts up really high in the nasolabial fold, apex of the nasolabial fold, wraps around the nostril, and then follows every nook and cranny across the bottom, and then wraps back up and around, and then
Ah,
the excision comes down wide, almost mirroring the nasolabial fold, and then all the way across, and then again takes basically a crescent triangular portion of skin out from around the nostril. And what that allows is when you put it back together at the base of the nose, it lifts and pulls from out of the corners too, in addition to centrally.
and
Um,
how does uh, the current technique work?
it really only takes out skin from here all the way across the base of the nose and then stops right at the nostril. So it doesn't wrap up into the nasolabial fold. And what that does is it creates additional vectors of pull that are more oblique and lateral instead of just purely vertical. And then it comprehensively draws the entire lip in, shortening the vertical height and the horizontal width. You can even get some softening of the nasolabial fold, which can't happen with a subnasal lip lift. And it also lifts all the red lip all the way out to the corner, as opposed to just centrally in the middle third half of the
So
lip,
you
which is
so you're kind of getting a little bonus in this area where
absolutely.
as it pulls in, because as
And when you widen, when you decrease the width and the vertical height, it looks more natural. I thought people really look like bunny rabbits after after I would see subnasal lip lift results, because it only lifts the very central portion and then doesn't really do much laterally. And it looked odd. It just didn't look. I mean, it can look okay. It can look good. I'm not saying it doesn't look fine, but I just think that there's a better way to do it. I thought that there was a better way to do it.
And you came up with one that works,
Absolutely.
right?
This should change the gold standard in how lip lifts are performed.
The need for this, the
Want.
desire, right?
Mhm.
As you said, to be more attractive. Uh,
Mhm. Yeah.
are women more apt to do this procedure than men at this
Yeah, I
point?
mean, I do it all on women. I mean, I can't think of a male off the top of my head, but I could see a male wanting it done, I guess. But no, it's primarily lip augmentation, lip changing of the lips is primarily a female procedure. I do occasionally a male filler patient, at least in Georgia, in Atlanta.
Right.
Maybe different in Beverly Hills. I don't know. But 99.9% of lip patients are women.
Uh, but are more men coming in for neck,
Yeah, necks,
eyes,
eyes, yeah,
right,
noses.
noses? Uh,
I do hair restoration too, so I mean that's 99% male.
right. And I think that the word you use is the most important. Natural.
Hmm.
I know somebody who had a facelift years ago,
Hmm.
and I'm trying to be kind here. She looks like the Joker.
Okay.
I mean, it was a mistake. I don't know if she ever
Well,
complained about it, but it's awful.
well, that's about going to the wrong doctor, the wrong surgeon. Not doing your homework well enough. When aging face work is done the right way, it looks just really good and really natural. It's about the direction that you pull in the facelift, and the surgeon's know-how and techniques that really distinguish it. And I do an extended deep plane facelift, and I often am combining these with lip lifts. It's very common for people to sign up for both. And it just rejuvenates the whole lower two-thirds of your face naturally and just looks fantastic.
And of course, we all want to look young. The psychological aspect of both the lip lift and plastic surgery in general. Uh, if somebody has not felt that they look as good as they could, and all of a sudden they, after the procedure, they look great. It's got to be a big boost to their self confidence.
Oh yeah, I mean that's what my whole job is, giving people confidence.
That's it. I mean, that's
You want
a
to boil it down, that's
yeah,
basically, yeah, I
right.
mean, and you could see it. I mean, you could see it. You can even see their eyes are more engaged in their after photos. They just look like they came out of a $1 million, clothing store or whatever. Their shoulders are up higher, their back, their posture's better. They just look like they're enjoying their life more sometimes, and it is really rewarding.
I think that as we age, we all want to feel good. Do you think that after plastic surgery, after looking good, that they mentally feel better as well?
Yeah, I mean, I'm not saying you're curing depression with plastic surgery. That's not my intention here. Yeah, I mean, and people are doing it for different reasons. There's people who are going back out in the singles market. There's people who are on the singles market and just want to do some of these procedures. Age is just a number. It really doesn't have any bearing to me anymore. I do facelifts on people in their 30s. I do lip lifts on people in their late teens and 20s. It's really when they come to me and talk to me and say, "Hey, I want to change this about myself," and I agree with them, and we can do it, and then we move forward. It's that simple. Um, but people are living longer. They want to look as good as they can feel on the inside. Some people are doing it to remain more relevant in their occupation. And then the dating world.
Right, and the dating world is changing too, with uh, with the pandemic, with COVID, and we had talked about that previously. With a mask, you can't see all the whole face, right?
Hmm.
But
Yeah.
but if a person smiles, The smile gets into the eyes, and you can see that.
Yeah, absolutely. A smile is a signal. It's saying, "Hey, I'm friendly," or "I'm interested," or whatever it may say. There's different ways of smiling.
As you know me for the last year and a half or so that we've been doing these videos, you know that I'm a baby and afraid of pain. So I've got to ask, um, what about recovery and pain with the lip lift?
Um, the Peri-Alar Lip Lift, yeah, it does have a significant recovery. There's no doubt about that. Um, there's pretty intense swelling, because not just the type of excision that I'm doing, I'm also lifting the skin off the muscle to release everything and allow for a bigger lift. So it is a fairly aggressive dissection. Um, I tell clients most patients aren't really starting to become happy from a lip lift until about 2 to 3 months. Their lips are inflexible, they can't smile the same. And then I see all this garbage online and of other people that say they do lip lifts, at least saying quick recovery. And it's like, then you must not be doing very much in the surgery if it's that quick of a recovery. And honestly, with all the lip lifts that I do with my facelifts, patients complain about the recovery from the lip lift more than the facelift, actually.
Oh, that's
But
interesting.
uniformly, they are all super happy with the outcome.
That's that's the bottom line, if you will.
Mhm.
You
Yeah.
know, to have a happy patient. Let's talk a little bit about your training, because you have extensive training. You've mentored with, I guess, a, a doctor with international clientele, patients,
Mhm.
and uh, give us a little bit of a history of your background.
Yeah, did my residency after medical school in ENT, head neck surgery, where all we do is spend 5 years in doing surgical tech procedures and studying anatomy of the head and neck. And then I ultimately ended up going to New York to train with Dr. Andrew Giacono. And he's probably largely considered the number one facelift guy in the world at this point. I do the same facelift essentially. Um, and I mean, I was fortunate to train with him. I have nothing but great things to say about Andrew. And sometimes in life, you need a little bit of luck too. And I got lucky in that regard. And I'm thankful. And so I was the first fellow to train with him. And there's only one fellow a year, so there's only about 11 of us in the country now. And we do things the right way typically. Um, and we do things that are going to get excellent outcomes. So yeah, I mean, and then I came down to Atlanta because that's where I spent a lot of time in college and training, and decided it was a big enough city for me to open a practice in.
Got it. Where'd you go to? Did you go to school in at Emory?
I went to Emory for undergrad, and then I went to Birmingham UAB for medical school. Then I went back to Emory for ENT, ear, nose, and throat, otolaryngology, and then after that I went up to New York. So all told, 14 years of school training.
Wow, that's a lot.
It is a
Um,
lot.
it is a lot. Okay,
I'm not gonna lie, it's a lot.
you have kids. We can see their drawings behind your shoulder. Would you want them to become docs?
Probably not. No. Um, I mean, if one of them wanted to take over my practice, a ready-made practice for them to just assume, um, by all means, like, go for it if you really wanted to do it. But I would never convince them it was the way to go.
Right, but don't let them become actors either.
Yeah, no acting, right? Yeah,
Yeah,
that's a
that's
tough
hard too.
business.
Tough business. Listen, if you want information on the Peri-Alar Lip Lift, we've got information on how to contact Dr. Stong's practice underneath us. It's been there all throughout our conversation. And I'm assuming that if they go to your website, they can see befores and afters.
Absolutely. We have a whole photo gallery of lip lifts that they can look at and compare. And I have a whole page dedicated to the new technique, a separate Peri-Alar Lip Lift page from just the regular lip lift page with medical illustrations of actually how it's performed.
So people can be fully educated before they make a decision.
That's what I like. I mean, I prefer my patients to be very educated about what they're going to do.
Well, I look forward to our next conversation. We'll compare notes about food, theater, and traveling, because we've both been doing a lot of that lately. Listen, I thank you very much for joining us here in Late Night Health.
Thanks for having me.
My pleasure. I'm Mark Alyn. This is Late Night Health.